Well, let's stick on that carnivore piece. This is a diet that's gaining a lot of momentum, at least in my circle, it seems to be. And we know that your phase 1 is 20 grams of carbs or less. If that's good, why not go all the way to carnivore and have no carbs? Would that be better, or is there certain things we lose when we go down to that? Talk about your thoughts on that, or is that up and coming, something you're going to start testing and see if it's even better? Are the carbs in there just so people adhere to the diet? A lot at you there, but I'm just curious on how you feel about all that.
Yeah, well, again, from my vantage point, I need a certain level of not just observational research or people's experiences. I need some papers and having it vetted through the scientific method. And that we don't have that for carnivore like diets. You know, you can talk about populations who ate a certain way. When I think of what I teach, it's almost carnivore. I mean, it's carnivore-like. You know, like I joke because there was this paper recently that said keto-like, and what does that mean? You know, it has no meaning really. So, the vegetables, I know I was an author on the new Atkins for a New You with Steve Finney and Jeff Volek. This was 2010. So that, 13 years ago. And the idea at the time was that to get mainstream acceptance of something from a dietitian group, of course, they changed to the Academy of Nutrition and Dietetics. The old American Dietetic Association is now AND, the Academy of Nutrition and Dietetics. To get them to even kind of say, well, okay, maybe you had to have some vegetables. That's 2010. So it was like we wrote this book by consensus and had help, but we kind of drove the book. And in the fine print, it says, you never really have to eat carbs, but it's just in the fine print. So the Atkins company, which drove the book and the policy about it, wanted to be sure they were checking the boxes of the mainstream. So now, as time goes on, I asked a carnivore proponent, Amber O'Hearn, to come up with a scholarly piece on whether a carnivore diet could give you all of the micronutrients that you need. And it's good. I mean, I'm not worried about a human eating micronutrients and getting everything from non-vegetable sources. And even then, I am worried about a human getting micronutrients from only vegetable sources. I mean, and then if you're going to be a vegan, you got to be watching out for vitamin B12, like a hawk. So I have less concern as a doctor who's dealing with some people don't know anything about nutrition and diet. Some people don't want to spend any time worrying about this, coming up with practical answers. Being just carnivore for some people makes it very simple. I mean, all I have to do is eat meat. And if you throw in eggs, so that's chicken and fish and maybe even, or some versions of carnivore are very strict, and wolf doesn't have coffee, so they can't have coffee. I mean, so there are all these different versions that I think are reasonable if you're following how you are. Someone came in, and this is just again being in a clinic. Someone came in losing way too much weight, so there was no awareness of that individual. So if you're not able to kind of see and I kind of remember, I don't really look under my neck much, I live in my head for a long time. So if you don't really have an awareness of your own body, you want someone else to kind of give you a judgment or help you with that, someone trained in it. So I think carnivore, as done by most of the reputable sources out there, I think is reasonable, and the tremendous kind of unbelievable stories. In fact, one of them, one person wrote a book about her experience. It was one of my patients, and I read about her in someone else's book, and I said, "Oh my gosh, that's Rebecca! That I knew her." And so her story is that she was diagnosed with eating disorders, and she was skinny. I mean, I remember she looked like, she was just really anorectic because she couldn't eat because it hurt. It hurt to eat, and everyone kind of assumed that was some sort of eating disorder like anorexia. And it wasn't. And it turned out that she had to figure out this on her own path of finding other people just eating meat. And so Michelle Hearn wrote the book, The Dietitian's Dilemma, which is basically she fixed herself by doing the absolute opposite of what she was taught as a dietitian. And then Rebecca Farmer wrote this book about her experience, basically reversing these things that I couldn't fix. I mean, we have no name for a problem where you can't eat vegetables so that it makes your stomach hurt. I mean, we call it an eating disorder because you ended up too skinny. And so a lot of these things are not medical. They don't fall into the medical world. And if you're feeling well, if you're not getting too skinny, and that, you could do that by a weight on a scale, a BMI, a friend, looking at you, and or a health practitioner helping you figure that out, and you don't force fasting. That's the other thing that's kind of weird, where I don't mind if you don't eat if you're not hungry, but I don't want you to ignore hunger signals. So I don't like the idea of forcing yourself to only eat once a day when you're hungry the rest of the day. So fasting has kind of gotten which version of it. And then eating those vegetables, I think, well, when you look at the list that we have of non-starchy vegetables, it excludes a lot of the ones that other people are sensitive to. That's fascinating. And certainly the gluten is gone on a program like we teach. The sugars, the FODMAPs, the FODMAP diet is a no simple sugar diet. Well, what I teach is also a FODMAP diet. It's basically an elimination diet of all of the artificial sweeteners artificial flavorings and colorings that you might see in processed foods that I think some people are sensitive to that. And finally, what we do is we tell people to have salt if you crave salt. And there are people who can fix themselves just by adding salt. And that's a theme in the migraineur treatment, that you can actually reverse and prevent migraines by just changing the food. So I know this goes along. When you fix the metabolism, you fix everything in the body. In fact, it becomes to that statement, it's so unbelievable, you won't believe me. And yet I can't withhold information from people to, at least give it a try. Finally, the heartburn, it's almost 100%. It's gone. And we don't get any credit for that. And that's probably one of after the statin medicines, these heartburn medicines are so commonly prescribed. Again, you don't need to have those. But a lot of ways to be healthy. I think carnivore is I would like to see clinical trials so I can straddle the world of, here's some science behind it. I'm told that's in the works, but, I haven't seen that data yet.
One of the concerns I'm sure a lot of people that would come up for them as we start talking about cutting carbs down to 20 grams a day or taking that even further to the carnivore diet would be lack of fiber for the microbiome. And these days in the health world, there's so much talk around the microbiome and feeding that and the health benefits. How do you think about that?
Amy Berger, who wrote the End Your Carb Confusion with me, I made her be a co-author, not a ghost writer. We would joke about it, and not the microbiome again. It's such a distraction. So I think the physical manifestation of a complicated, busy, colorful microbiome is heartburn, irritable bowel syndrome, and all of the other things that doctors treat with drugs. The beauty of the microbiome change on a low-carb diet is that the number of bacteria decrease, the amount of bacteria decrease. It calms things down. In fact, there was a world expert microbiome research showed a slide click of tropical rainforest, basically saying this is a healthy microbiome. And I'm like, there are things that they're dangerous things in a rainforest. I mean, snakes and all, and I think it was click, a microbiome on a low carb diet is like this desert, and I'm like, wow, that seems calm. I could meditate there. And I knew I was going to southwest US after this was a conference in Geneva. And so I thought, okay, when I'm in Tucson, I'm going to ask, is the desert beautiful? There was a scientist that said there's nothing in that desert. And they go, yes, the desert, beautiful. It's got flowers and the beauty of the sun. So I think the calm nature of a low-carb microbiome is what I see every day. And it takes away the gurgles and the pain and the heartburn, and you don't need drugs to treat it. So that's like, and the fiber thing, fiber is just a way to sell products. These are association studies of, you have high fiber and all these good things. When that was finally turned around into a clinical trial for colon cancer prevention, which is one of the big reasons people talk about fiber, it didn't reduce the colon polyps or colon cancer by giving people more fiber. So that's another criteria that with associations, you really need to turn it into a prospective clinical trial, ideally just manipulating one factor. And fiber is really, really overrated. And you don't need to eat fiber.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
I've had people, even if they've been on insulin for 20 years, get off the insulin in as little as 8 weeks. The weight loss happens about 1 to 2 pounds per week. My philosophy is to get it to work the first time.